Welcome to IVF Unplugged, the honest voice for aspiring parents. Parenthood is one of the most nurturing human relationships with the potential to shape the next generation. Every couple's journey to conceive is deeply personal and often different. Not every path is perfect, and that is perfectly okay. What matters most is taking the first step with hope, the right information, and the right support. In our very first episode, we begin from the very beginning. If you have ever felt confused or unsure about IVF, which is in vitro fertilization, what it really involves or when to consider it, this conversation is for you. Over the years, many public figures have openly embraced the IVF process on their journey to parenthood. These choices have helped break the silence around fertility challenges and encouraged more open conversations. Joining us today is Dr. Florence Vijay from Cherub Fertility Clinic, a fertility expert who has supported many aspiring parents on their journey. Dr. Florence, thank you so much for joining us today. Shall we begin?
Yeah, definitely.
So can you tell us more about the IVF procedure, what it entails, what are the key stages from the consultation to the embryo transfer?
Yeah, thank you for the question. I want to walk you through the whole IVF process. IVF process is a coordinated series of steps which is carefully designed and to assure the couple without any confusion they should go forward with the starting initial consultation, and it ends up with the embryo transfer and pregnancy test. First stage is initial consultation with the consultant, fertility specialist. So it involves a history taking for both the male and female. The history will be taken thoroughly, whatever the previous treatment they have undergone, or whether it is the first initial consultation, and then we will assess the both partners with some hormonal test to assess their fertility status, and then we will ask them to will do transvaginal ultrasound for the female partner to assess their anatomy, whether any issue is there or not, and if needed any other special test we will ask them to undergo. That is the first step, initial consultation and history taking. And the second one is ovarian stimulation. If the couple have to undergo IVF procedure, then we will start ovarian stimulation. Ovarian stimulation is giving gonadotropin injections through around 10 to 12 days of injections will be needed, and throughout the cycle, the female will be monitored with transvaginal ultrasound about the follicle growth. And once the follicle reaches the proper size, in between we will adjust the dose of the injections to have a maximum number of follicles. And then once it reaches the proper size, then we will plan for the trigger. The third step is egg retrieval or oocyte pickup. Usually after trigger injection, 34 to 36 hours after trigger injection, she will be supposed to undergo a small minimally invasive procedure or conscious sedation. We will try to retrieve the follicles. It will be under transvaginal ultrasound guidance, and we will take the follicles through the follicle fluid. We will take the egg and we will hand over to the embryologist so that he will separate the egg from the follicle fluid we collected from the ovaries. And then the fourth step is the sperm collection from the male partner. And whether it will be fresh or the frozen sperm, which we would have frozen it, or sometimes if needed we will go for donor sperm. That is according to their history, and that sperms will be separated and motile moving sperms will be taken by the embryologist. And the fifth step will be the IVF, this thing with the collected eggs and the sperms collected from the male partner. We will supposed to undergo either a conventional IVF or ICSI procedure. Conventional IVF is we will take the motile sperm and we will co-incubate with the follicles, oocytes, whatever we picked from the female. Otherwise, if it's an ICSI procedure, we will take each an individual egg and we will inject one sperm into the each egg and we will incubate it. Then after the fertilization process gets over, it's called zygote. We will incubate the zygote, and then sixth step is we will incubate the embryo. The embryo will be cultured through the series of monitoring in the IVF lab. So on every day daily monitoring will be there. Mostly on day 3 it will go to the cleavage stage, and day 5 it is called blastocyst stage. If it grows up to day 5 blastocyst stage, the success rate will be little more better. Then we will plan for embryo transfer. If we are going for the fresh embryo transfer, we will do it on day 5. Or if there is any other indication which is contraindication for embryo transfer, we will freeze the embryos. Or if we are going for fresh embryo transfer, the surplus embryos will be cryopreserved for future purpose. And then after embryo transfer, 12 to 14 days after embryo transfer, we will do a pregnancy test, beta hCG pregnancy test, and see whether the patient has got positive result or not. To summarize, the IVF is a highly personalized, individualized process which needs meticulous monitoring and counseling on and off, and we have to, throughout the journey, we have to go along with the clinician, and patient relations should be clear, and then only it will end up in a highly success rate.
Right. But doctor, when should aspiring parents consider IVF as an option? Who is it best suited for?
Actually, IVF is not the first line of treatment for all infertility procedure, but for some couples, it's the most appropriate needed procedure they have to avail. Actually, for some patients, IVF is the only option it will be there. So mostly, I will point out some of the examples. Patients who are having fallopian tube blockage, that means every woman have two tubes, there only fertilization will happen for everybody, every female. But if there is any blockage or any damage in the tubes, then the IVF is the only option for them. And females who are having advanced maternal age, so who are more than 35 years, the fertility will be declined in them, the fertility potential will be declined in them, and those people, those women has to undergo IVF. That is the first line of choice. And who are having male factor infertility, if the husband is having azoospermia or a severe oligoteratospermia or obstructive zoospermia, the IVF is the only option. Instead of that, if they cannot go for other options like ovulation induction, IUI, any other procedure, non-invasive procedure, so they have to go for IVF. And endometriosis, severe endometriosis will have a scarring, inflammation in the ovaries, and it will further decline their fertility stage. So those patients also has to go IVF in the first choice. And who are having unexplained infertility, and who are having genetically predisposing history. So in those patients, we have to do a pre-implantation genetic diagnosis, and then only we can transfer a euploid embryo. And patients who are having recurrent pregnancy loss, for those patients, IVF is the first line of treatment. Like that, we will choose the patient.
Okay, got it. But it's commonly believed that time is very important criteria while dealing with infertility. Do you agree with that?
Yes, definitely, I agree with that, because IVF is already I told you, IVF is not the first line of treatment of choice, but some certain conditions, IVF is the only option will be there. In that case, if they delay further, the success rate will be more. Most important thing is the age of the woman is the most important one. For women age below 35, the fertility rate will be better. In those women, they can wait up to 6 to 12 months. But if the age is more than 35, they should not wait more than 6 months. They should come to the infertility specialist and get the treatment done. Because after age of 35, the fertility potential will decrease, and quality and quantity will decline. So in that case, IVF will be the first line of treatment for them. And duration of infertility, couples who are undergoing are not able to conceive for more than 3 years, and they even undergone ovulation induction, IUI, some other procedures also. If they are not able to conceive, they should also without any delay come to the doctor and they get the IVF procedure. And this thing, whoever having some certain conditions like endometriosis, and who are having any fibroid in their uterus, and recurrent pregnancy loss, and patients who are having diminished ovariation, even someone nowadays girls at the age of 26, 27 and like that 30 years also, if their AMH level is very low, IVF is the best option for them. But usually they will think that we are at young age, so that we can wait for some more time. It's not like that. Their AMH will be declining furthermore, so they have to go for IVF in the first line of thing. And couples who are emotionally and psychologically very vulnerable, and they should also delaying the treatment, IVF treatment will add on more kind of anxieties, depression and all. So they should also think IVF is the first line of treatment, and they should not delay. So delaying the treatment will further worsen the success rate of getting pregnant easily.
Okay, got it. What are some key questions which aspiring parents should ask during their first consultation with a fertility specialist?
Okay, this is an important and practical questions you have asked, because first consultation is the main thing. In our clinic also, who are coming for the first consultation, we will spend a lot of time in explaining each and everything to them, because in the initial consultation, if the couple is getting their doubts clarified, then only the further journey will be smoothful for them. Because it's not like other conditions like where we go and get the medication on the day itself and come back. It's not like that, because it starts from initial consultation, then we have to change the lifestyle, everything will happen. So in the initial consultation itself, they have to ask the clinician about what is the causes for the infertility, whether it's a male factor, female factor, or combined factor, or an unexplained factor. They have to ask the clinician what is the reason for their infertility. And then second thing they have to ask is what are all the treatment options available for them, either non-invasive procedures like ovulation induction, follicle study, and IUI, or any other procedure, or they have to go for invasive procedures like IVF and all. And then third thing is they have to ask what are the chance for success in their cause of infertility, and they have to get clarified. And they have to ask cost of the treatment, what are the expected cost of the treatment, so that they can be financially they will be ready to face the situation. And they have to ask what are the risk and side effect of the IVF treatment, because IVF, the most common complication of IVF is ovarian hyperstimulation syndrome and multiple pregnancy. If they end up with ovarian hyperstimulation syndrome, what all will be the everything they have to get clarified with the consultant. And the main thing is this is a procedure which will take a continuous 12 days to 15 days of stimulation. They have to come from their work and get the injection, get the scan done, everything. So they have to ask the clinician when and how many times they have to reach the clinic, and according to that they can plan for their work schedule. And then cost breakdown of the IVF procedures they have to ask, and they have to ask about the advanced technologies in the clinic they are going to consult, and whether whether they have to undergo the procedure if in case in the last minute. Everything they have to get clarified in the first consultation itself. And most important thing is they have to consult the doctor about the lifestyle changes they have to undergo. So whether they have to reduce weight, and the male partner has to stop smoking or alcohol, and whether they should have a good sleep and diet changes, and whether they have to reduce this anxiety, everything. And if they are unable to reduce their anxiety, they have to get support from the consultant and with the counseling team. So it's like a big procedure, but it's a easy procedure if the both of the clinician and patient both have this thing a good understanding.
Okay. Just to conclude the conversation today, IVF can take a toll on a couple mentally, physically, financially. So how important is it really to get an experienced specialist to help you through your IVF journey? Is there a checklist perhaps that you can suggest to help select the right specialist and the right kind of products?
Yeah, definitely, absolutely. Because nowadays IVF center is many of the areas, more lot of IVF centers are around us. So choosing the right specialist, right clinic is the most important one. They have to decide, and the main thing is first they have to when they are trying to go for an IVF procedure, then they have to do the right clinician. Right clinician. They will be updated with the recent development in the IVF procedure, and they will use the evidence-based approach, and whether the clinical expertise is up to date, that they have to check, and whether the doctor is compassionate and very empathetically speaking to their patients, like that they have to check, and they have to check whether the doctor is associated with the good IVF lab where the quality is maintained, and when the hospital they have to where they are going to give the blood test, everything, that lab should be accredited with the proper NABL certified, like that. And third one is whatever they are going to get the medications, right? The hospital should be using the medications, drugs from the good reputed pharmaceutical companies. They should not use the not branded ones, like that. They have to use the good quality and which will give a good result. That kind of companies, drug companies only they have to use, and they should be with pen friendly devices, like pen injections, which is very less painful, so that daily injections they have to take, right? So it should not be painful for them, and it should be easier, and patients themselves can get the injections done. So they have to check the right clinician, right lab, and right team. And another one, they have to check the clinical pregnancy rate. They should not, because it is an individualized one, they should not think about just positive success rate. They have to take home baby rate. They have to check wherever they are going to get the treatment. They have to check that, and they should not go according to the others thing. They have to individually, they have to research and then check, and then go to the right clinician and get themselves treated.
Got it. Well, thank you so much, Doctor, for joining us today on IVF Unplugged, the honest voice for aspiring parents, powered by Merck. It was great having you talk to us and our viewers in so much detail.
Thank you. Thank you so much.
And we hope today's conversation has given you clarity, comfort, and confidence as you take the next steps on your journey to parenthood. Remember that every story is unique and you are not alone. Until next time, take care.